Welcome to Friday Friends, RI Elder Info's weekly look at the organizations and individuals providing resources for Rhode Island seniors, caregivers, and professionals.
Good morning, everyone. Welcome to Friday Friends. I am Deb Burton, the founder and creator of RI Elder Info and rielderinfo.com, the most comprehensive resource for seniors, caregivers, and professionals here in Rhode Island. We are a nonprofit, and if you're just joining us for the first time, this is our show Friday Friends, where I interview different nonprofits from around the state that are doing some really cool stuff that people need to know about. You may or may not be aware that May is Mental Health Awareness Month. It is also Older Americans Month. So there are a lot of things to celebrate here in May. What we do is not possible without the support of our sponsors and our donors. So big shout out to Oak Street Health. They have they provide wonderful primary care, comprehensive primary care to individuals who are on Medicare. They have offices in Warwick over by the Christmas tree shop, 2 in Providence and 1 in Woonsocket. Also, one of our sponsors, Tamarisk Assisted Living Facility, a really home-like atmosphere located right over by the malls, easy on and off the highway. You can give my friend Susan a call over there, and she'd be more than happy to show you the facility and talk to you about the services they provide. What I do wouldn't be possible without the wizard behind the screen, D&B Media. Ben Barber's D&B Media is backstage making sure that this all comes out smoothly for you guys to see. And if you saw any kind of promotion for this, or if you've ever visited rielderinfo.com's website, which I'm sure you visited the website, right? That is from the magic of England Studio. What we do wouldn't be possible without the folks who support what we do, who really believe that information is power and no one should suffer from a lack of it. So today I am really excited to talk about mental health and an awesome program, an awesome place, an actual physical location that you can go to here in Rhode Island called BH Link. So my guest today is Stephanie Culhane. Welcome, Stephanie.
Hi, thanks so much for having me, Deb.
Yeah, hi, Steph. So tell everybody, what do you do and what is BH Link?
Okay, so first let me tell you what BH Link is. BH Link is the state's first emergency triage center. We are located over at 973 Waterman Avenue in East Providence. We are a stand-up facility. So what we really are is it's a grant through BHDDH, which is the state's Office of Mental Health. And what we are is an alternative to going to an emergency room for anybody that is having a behavioral health emergency. So for somebody that might say, I'm really struggling right now with either a substance use disorder issue or some type of mental health issue, and traditionally they'd go to a regular emergency room, they can come to BH Link, they can come to our facility, and we will help triage whatever their issue is in that moment and get them to the next best, what we call level of care. So for some people, when they come to us, they're going to need to go on to a hospital setting. We'll get them to that hospital. Someone might need residential care for substance use treatment. Somebody might just need some information on, seeing a psychiatrist or seeing a counselor. We also do inductions for medicated assisted treatment, so we can do induction for Suboxone. It is a one-stop shop for anything that you would traditionally go to an emergency room for behavioral health issues. We can do in what I like to think of as a much better setting. It is a quieter setting. It is dedicated to only behavioral health. So as opposed to going to a traditional emergency room where you're going to be sort of lumped in with a whole lot of other things going on, all our case managers, all our clinicians do is treat behavioral health issues. So we will, when you come in, You're going to be greeted by a peer. We feel that the peers are some of the most important people that you'll meet when you first come in, because that's someone that has a shared experience with you. You're going to be screened to make sure that you're medically appropriate to come to us. So a nurse will see you, and a nurse is just going to make sure that you don't have some sort of medical complication going on. And then we have 7 days, which are very private. You're going to go into your own room. It's dimly lit. We have quiet music playing. We have aromatherapy going. So it's a very non-confrontational, it's not busy, it's a quiet setting. And then you're going to meet with a licensed mental health clinician or a licensed social worker. And they're going to talk to you about why you're there and what is going to be the best treatment for you. We don't provide treatment at BH Link, but we're going to see what you're going to need next. And then we're going to get you to where you need to go. People can come to us either, they can come on their own, they can walk in, they can have a friend bring them, they could come via rescue, they could come via ambulance. Sometimes police will bring people to us. We see people from all over the state. We are a statewide triage center. So people from Westerly to Woonsocket can come to us. And we also have several vans. So if somebody doesn't have transportation, we don't want that to be a barrier. We can get people to us, and we can get people to their next level of care, and we can get people home. We also have a call center. We're open 24 hours a day, 7 days a week. So someone that maybe is reticent to come into the building can call us, speak with one of our call center providers about maybe should they come, or can we triage their issue over the phone. And then we also answer the 1-800 National Suicide Hotline. All calls that come into Rhode Island are answered at our facility in our building. And we are very proud to say that we were recognized earlier in the year by the National Suicide Hotline as having the highest call rate in the nation. We answer 99% of all calls that come into the Rhode Island phone number for the National Suicide Hotline. So we're very, very proud of that in being able to help people with their mental health, behavioral health issues.
Wow. So it sounds like there's a lot of different opportunities there for folks to get help.
Yes.
I know, do you find, is it common for our older adults to have mental illness? Is that something that is frequent?
Yes. So my role at BH Link, my title officially, I am the Healthy Aging Behavioral Health Liaison. And so what my role is I work in a grant that is supported by the Office of Healthy Aging, formerly known as the Division of Elderly Affairs, or DEA. And what I do is I work with providers throughout the state and our providers at the BH Link to work with older people, 60 and older, that have behavioral health issues, whether it's a substance use disorder, whether it's a mental health disorder. And I think what happens in our older population is, for whatever reason, people are very reluctant to recognize that there's an issue. They're reluctant to label it. For many years, people have gone untreated or undiagnosed. So, you may have a family member that for years, everybody around the dinner table said, oh, well, we know she drinks too much, or, she's always had issues. That's what we always heard growing up. She has issues. Those issues are, she has a mental health problem, and no one ever wanted to talk about it. And maybe they didn't want to get it diagnosed, or their family just pretended it wasn't an issue. So yes, there is a high prevalence of mental health issues in our older population, but sadly, I think it has for too long gone unrecognized, unnamed, and undiagnosed.
Yeah, it's very interesting, because if you look back at what our mental health services were when some of our older people were younger people. Mm-hmm. If you were depressed, or maybe you had bipolar disorder, which is formerly called manic depressive for folks who are watching who don't know, there was a good chance that you could be locked away in, say, Eleanor Slater Hospital and never come out.
Our older population probably remembers the days of, think about President Kennedy's sister, who probably had a very treatable mental health issue. She got a lobotomy, So Think about, our older population remembers days of the Lad Center. They remember days of, Eleanor Slater Hospital is not what it, we used to call it the IMH. Oh, she's going to end up at the IMH.
Yep.
We have very, even now, Butler Hospital provides wonderful psychiatric care. What's a common phrase someone says? I'm going to end up in Butler. Nothing wrong with ending up in Butler if that's the care that you need, right? But unfortunately, I think our generation, and most certainly I know my children's generation, is much more open about talking about mental health issues and getting help. Here we are, May is Mental Health Month, and everywhere I turn, people are wearing green bracelets and talking about Mental Health Month. Social media has posts all over the place. We see famous stars and people all over on the news talking about mental health and getting help. But our older population still isn't there yet because of their past, like you just mentioned, Deb. Their past is still caught up in those memories of how we used to treat mental health. If you had a problem, you were institutionalized and never heard from again. You didn't get treatment. You were punished for having mental health issues. And so our older population, we're still living with the effects of that.
Yeah, absolutely. So if you are someone who is maybe caring for your parents or someone, what are some of the signs of a person in need of treatment for a mental health issue?
I think it's important to recognize the fact that there are big differences between an older person who's suffering from, say, a mental health or substance use issue and dementias. So that's sort of where I try to do some training with my staff and with family members and with providers in the community to understand when it is appropriate to send an older person to BH Link, because dementia isn't a mental health issue. Dementia is more of a medical issue. So not to say that mental health issues aren't health issues. They are. A mental health issue and a substance use issue is every bit of a medical issue and a health issue as having kidney disease or heart disease or anything. But I think if you're a caregiver or a family member, things to look at are, think of the history of this person. Think of, especially if we're looking at substances, is your loved one increasing in their usage? So let's say they were prescribed a medication coming out of a hospital. Are you seeing those pills disappearing more quickly? Are they trying to seek refills more quickly? Are they taking those pills or medications when they're not supposed to be? And are they making excuses for using those substances? Well, I just had an extra drink because ... or I needed because ... Are you seeing empty bottles in the recycling bin? Are they hiding that they're using these substances? That's also a big indicator. And as far as mental health issues go, those are sometimes a little harder to be able to tease out. But I would say that if as a caregiver or a family member, you have a question, it's really important to maybe have a conversation with your loved one's primary caregiver. And if you don't feel you're getting the answers you need, seek out another primary caregiver, because unfortunately what we're finding in some primary caregivers, particularly ones that are seeing older clients, they've got their 15 minutes and they don't want to deal with this. They don't want to have to deal with, we really think that, grandma has a mental health issue. We think grandma's depressed. We think if grandma had a little bit of medication, or maybe if she talked to somebody, she might be able to come out of this funk that she's in. They don't really want to recognize that, either because they don't have the education, they don't have the time, or they just don't understand geriatric psychiatry or psychology. So I would say to be an advocate, and if you see something, do some further investigation. Trust your gut on that, because it's really hard to tease that out. But if you feel that there is a difference in behavior, or you feel that there is really just something there and that's tugging at you, the first thing to do would be to have a discussion with your loved one. But if that isn't going anywhere, then I would say try to have that discussion with the primary care provider.
It's interesting. I was watching a training yesterday, and they were saying that there's this misperception that older adults, and there was no definition as to who qualifies as older adults, which is always good fun. But there's this misperception that, once you become an older adult, that you're naturally going to be depressed because you're towards the end of life. But the actual science, the actual research data says that's not true.
Correct.
Could there be periods? Sure, you're going to grieve if you lose your spouse. You're going to grieve when your siblings pass and maybe your friends. But to become depressed is not a normal part of aging.
Right.
And so you mentioned dementia, and dementia, there's many different causes of dementia, and there can be a lot of different behavioral components with dementia. And can BH Link really address any issues when someone, say, has dementia for any variety of causes, because we know that dementia is a symptom of something else? If they're having some behavioral disturbances, perhaps the individual has become aggressive, or is really full of anxiety. Is BH Link able to help with that situation?
So I would say the best thing would be to give a call to the call center and speak to one of our call center providers, because if it's not something they feel would be appropriate to come in, and they know it's somebody that's 60 or older, then what they would do is they would put you in touch with me, and then I could sort of discuss that with the family member about what might be a great option for them, what the resources that are out there. Because behavioral disturbances in people that have, or behavioral issues, I don't like to say disturbances, behavioral issues that happen with dementia are treated sometimes very differently than a behavioral disturbance that happens in the course of some type of mental health crisis, or some type of, mental health, exacerbation. So I would say give a call to the center and see, and they can always triage that and see if if BH Link would be an appropriate setting for somebody to come in. Yeah, absolutely.
And I did want to just alert our viewers that if it is a situation where someone you love who's older, if they've been having, say, a glass of wine every night with dinner, and they need to go into the hospital, maybe they've fallen, or, could be any number of reasons that they're going into the hospital. It's really, really important that you tell the medical team that your loved one has that drink every day. It can have some medical consequences when they don't have that drink every day.
It is so important. And, it's one thing that when I was a social worker for years at a nursing home, and it was always part of my psychosocial history. And you'd be surprised how many people, how many family members don't want to talk about that. But the withdrawals from any type of alcohol or medication can, in some cases, can be deadly. So it's really important to notify your healthcare providers. And it's also important for healthcare providers to reserve judgment on those things. Get at the core of the issue in the moment, and then we'll deal with triaging the situation later. I remember having a case with one client, and the family members finally all kind of sunk into my office and said, listen, mom's an alcoholic, and we have to figure something out. We can't keep doing this. And we finally had a roundtable discussion with mom, because we want people to be autonomous, right? Just because you turn 60 doesn't mean you get to stop deciding.
Absolutely.
Just because you're 90 doesn't mean you get to stop deciding.
Yep.
You should have full autonomy until the very end, right? Yep. For as long as you can keep deciding, you should have full autonomy over your decisions. If you don't want to get help, we want you to get help, but that's your choice not to get the help. But this woman finally said, all right, I'll go. And she was about 72, and she went into a residential treatment program. Now, if you think that's easy to try to find residential treatment for people that are 60 and older, that's a whole nother conversation for another time, Deb.
Oof, yeah, absolutely, absolutely.
It was a conversation we had, and we got it done. And she was very brave, and her family was brave for coming forward, because these were adult children of an alcoholic that had lived a really long time and didn't know where to go and didn't know where to turn. Yeah. So I was really proud of them. I was proud of her, and I was kind of proud of me for stepping forward to be able to. Because a lot of times providers just don't want to have that conversation. They don't want to have that conversation. It's a lot easier. It's messy.
It is.
To approach someone and discuss their problems with them and discuss these issues. But I hope that we're coming to a turning point. I think that BH Link has really worked hard to open up the discussion with people about looking at mental health as it's a disease. Substance use disorder is a disease. And if you would treat your diabetes and you would treat your heart disease, why wouldn't you treat your mind?
Right. Right. And it's okay to not be okay.
It's what I say every single day to people. It's okay. Why do we always put on this brave face and pretend like we're okay? Stop doing that. It's okay. We shouldn't have to wear these masks all the time. It's okay to say, I need some help. I've got to figure out how to get through this. And I'm so proud of BH Link, and I'm so proud of the role that I have. And I'm really proud of being able to do this through the Office of Healthy Aging, that we are finally at a point where we are recognizing that behavioral health doesn't end at 59. We have older people that really need to be able to get the help that they need to. So.
Yeah, and BH Link might be the first opportunity that they've had.
It's true. I mean, there are other opportunities in the state. There are other emergency areas that offer this, but we're the only one. We're a stand-up. So there are other behavioral health emergency rooms, but we're not affiliated with a hospital. We're not affiliated with a big conglomerate. Mm-hmm. We're a grant-funded opportunity, so we don't have any. We don't answer to any sort of corporate conglomerate of any sort. We answer to the state, and I actually am employed by Horizon Healthcare Partners, and Horizon Healthcare Partners is a conglomerate of 5 community mental health organizations, and we all work together to provide a better continuum of care for the people that seek mental health care from our community agencies.
If somebody's not able to get there, does BH Link have the ability to send someone to a person's house?
So we actually work with a number of, we work with something called the SOAR grant. It stands for the State Opioid Response, but it's become a lot more than that. They're really more like mobile clinicians. And so what that is, they're actually housed sort of geographically. So depending upon where you are, we have the ability to be able to send a clinician out into the community and meet someone in the community, and they can sort of triage a situation at a person's home, depending upon what the need is of that person. So it's sort of need dependent on what the issue is in the person's home. BH Link we also have what's called the MCAS program that sort of works hand in hand with the SOAR program. Right now, it's only in the East Bay area, but we're hoping to expand that. The state mental health, which is BHDDH, is really seeing the importance of mobile clinicians and seeing how important it is. So they are really prioritizing moving forward over the next couple of years. We have this big mental health block grant that is sort of comes from, not to use all these terms, but SAMHSA is the federal mental health monies that are sent down to states. And they're really seeing the benefits of mobile clinicians. So we'll be getting more monies to be able to be sending more mobile clinicians into the home. So someone could call BH Link and we would sort of see what the situation is and work to sort of triage to get somebody out into the home. The idea would be that we'd be triaging them in their home, but then getting them someplace, either to BH Link or to either emergency room or to some other level of care.
Yeah, and I think that's really important, is that there is the ability to have someone come out to the house, because sometimes there's mobility impairments and that kind of thing. And an individual might be resistant to, say, get into the car if, your historical experience is, once you get into that car, you get dropped off at the IMH,
right,
and you never come out. So people might, that might cause additional anxiety and stress to be able to do that.
Yeah, I've been able to do that, fortunately, with a number of the clients that I've worked with in my, OHA program, to be able to get a clinician out into the community to triage the situation.
Yeah.
So it's really something that the state is understanding there's a huge need for. So moving forward, I think we'll be seeing more mobile clinicians and more opportunities for that level of care.
Mhm. And for BH Link, for individuals who go into BH Link, or if the mobile treatment team feels that the individual needs to go into the BH Link,
Mhm.
is it a locked unit? Can people leave? How long can they be kept?
So for people that come to BH Link, it's completely voluntary. So no one comes to BH Link and the old term is SERDed. So, somebody that is forced to go and has like a 3-day hold at a psychiatric unit, you're coming to BH Link because you want the treatment and you want to be seen and you want care. So as you walk into BH Link, you can walk out. It's not locked. It's locked coming in for the safety of the people that are with us, but the door is not locked to leave. We can have people with us for up to 23 hours. Because we're not a hospital, we are licensed as a triage center, but more almost like, a walk-in treatment center, not exactly like we have some gray area in that though. So in other words, if we haven't been able to place somebody after that 23 hours, we're not going to kick them out to the street. We have ways to be able to hold on to them until we get them to their next safe level of care. There could be instances where if somebody is a danger to themselves or others, because we do have licensed clinicians, we do have the ability to put a hold on someone if it's necessary. We don't want to do that though. We want to try to get a person to buy into the fact that they need that care. But if it's an emergent situation and we have to, we can do that. The other thing that's important to know is you don't have to have insurance to come to us. We take insurance. We will. There are certain things that we can bill for because we have nurses and licensed clinicians. So we certainly will do that if we have the opportunity. But we can either have insurance, we can have no insurance. You can be underinsured, you can be undocumented. The only issue will be is getting that next level of care. If you need to go to the hospital and you have no insurance, that could be a bit of an issue. Yeah. But we will then work to see how we can get you the care that you need.
And so any insurance, no insurance, anything like that. What about individuals who might be undocumented? Is there any reporting to the state if they sought help?
No. We keep data, you know what I'm saying? So we do keep data because we are a grant. Mm-hmm. We do have certain data that we have to keep, but we're not going to be reporting that person to the state. So we keep data, but it's all unidentifiable.
Okay, so that's good. So people don't need to be concerned about their immigration status and getting turned in and anything like that.
100% no.
And do you serve individuals who speak other languages? Do you have clinicians who
we do
have the ability?
So,
okay.
We have, I believe we have on staff, we have people that speak Portuguese and Spanish. We may at times have somebody that speaks a couple Creole dialects, but we also have interpreter services. So if somebody comes into our center and we don't have someone that speaks whatever that language is, we have the ability to have a call center that we can call into with something like 50 or 60 different languages, so that we may not have them on site, but we certainly can call into a 24/7 call center to be able to access that language.
Awesome. So you've got a contract in place to get interpreters to give culturally appropriate care. That's really good.
Absolutely.
Heidi Ross had a comment. She said, I had the pleasure of taking a tour of BH Link before the pandemic hit and was pleasantly surprised how unhospital-like it felt. Smart model with caring professionals. Same with the call center. Way to go, BH Link. Thanks for being there.
Thanks, Heidi. I appreciate that. I think I took you on that tour, Heidi. That's the one thing that really strikes me. Even when I first came to work at BH Link, we've only been open since 2018. And it's a 5-year grant. So, some of what we do, what we were doing before the pandemic, we actually lobby at the General Assembly. We need our General Assembly to understand this can't be one of those grants that we've seen before, where in a few years we go, remember when we had that awesome place, BH Link? Wasn't that great? Too bad we couldn't keep it. No, we need to keep this. We need to grow it. We need a center in Southern Rhode Island. We need a center in Northern Rhode Island, right? We need to make this something that lasts because it is so different from other places. You walk into our clinic, you wouldn't know. You'd think it was a doctor's office. You wouldn't know that this is a mental health triage center because that's not what it looks like. We don't treat people, as if this is some sort of, it's just a different level of treatment. And what I always tell people is your crisis and my crisis might look completely different. So we don't have a barometer for what a crisis is. Your crisis could be you're grieving the loss of a loved one. My crisis could be I have an active plan for suicide. We're not going to measure that. We want anyone that's having what they feel is a crisis to feel welcome, and we're going to meet them where they are in what they're ready to do and what they're ready to receive.
And you have, because I too have toured the facility, I think one of the nice things is when you go in, you have someone who is meeting you at the front desk.
Yes.
And the first answer is not, here's a clipboard, fill this out with your name, address, telephone number, insurance information, what's wrong, go sit down over there and wait for your ticket to be called kind of thing. It is not that environment. And I think, you know, when you think of going to some of the big hospital emergency rooms, you know, you have to go up to, say, and I mean, no disparagement here.
Right.
If you go to Rhode Island Hospital, you go to the window, you check in, they take your insurance, they take all that info. Okay, go sit over there.
Mm-hmm.
And then you wait, and then you get called back behind the curtain, and then you wait some more. Mm-hmm. Which you've got a lot of things happening around you. You have other people who are in maybe a different kind of crisis. It is noisy. It is bright.
Right.
It is not necessarily peaceful, calming, things that want to help your body naturally kind of come down a notch or two. And that's something that BH Link provides, is that atmosphere.
The thing that's so important, and as I said this, and if any of my staff is listening, I love you all, but you're first met by a peer. And so for anybody that doesn't know, peers are people that have a shared experience. So sometimes a peer is, it's just someone that has a shared experience. Mm-hmm. So a peer meets with you, and that's somebody who's been there, somebody who had a substance use disorder, somebody that had a mental health disorder, someone that has walked the walk and understands where you're coming from. They're the first person, and they just say, hey, how are you? What are you here for? You may have to sit for a few minutes in the waiting room, but then we immediately bring you in. Now, we only have 7 days, right? So if we're completely full, there may be times where you have to sit and wait. And unfortunately, there could be times where we may have to divert you, where if you don't want to sit and wait in the waiting room, we may have to say, if your situation's really emergent, you may have to go to the hospital. Again, state gods with the money. We need more money to open more facilities. But for now, so those times are few and far between, but they do happen. Mm-hmm. But you're not waiting in a room full of people. And I've done it before. I've done it with family. I've waited in a room full of people. It is disparaging. It's demeaning. It is depressing. And you're already there because you're having an issue. Mm-hmm. That's not what we do. It's so different. And I'm not saying it's a wonderful experience, right? Because you're there because you're in a low point and you need help. Mm-hmm. But it's a different experience, and it's a good experience. Mm-hmm. And I can say that too from firsthand family experience. I have family that have been at BH Link mm-hmm. and have been at other facilities, and I can tell you from their firsthand experience, they now tell their friends, go to BH Link first. Go to BH Link first. So I'm not just a spokesperson, you know?
Yeah. And everything's kept confidential.
100%. We obviously, we're a healthcare facility, so we have to follow HIPAA to the highest regard. In fact, when I took my family member there, they're like, can you go to your office and not come back here? And if she wants to talk to you, we'll come get you. I'm like, say no more. Like, it was, even though I was there, I wasn't there. And they didn't talk to me. You know what I'm saying? It was like, I brought her there, but it was like, I wasn't there. Yep. Even though I worked there. Yep. So
do you think so you said it opened in 2018. Mm-hmm. Do you think, or do you know, has BH Link saved people's lives?
So we actually have, and I could probably share the link so that you could share it on your page at some point in time. Mm-hmm. I say last year because to me last year was 2019. In 2019, all of the broadcast stations and the PBS stations had a program called It's Okay Not to Be Okay. Mm-hmm. And one of our clients actually was interviewed, and she tells everybody we saved her life. She was a young mom. She had a plan. She had an attempt, and her husband brought her to BH Link, and she tells everyone that we saved her life. And she went on TV, broadcasted on, 7 network stations, and she told the world that we saved her life. And her story is amazing and compelling. And the reason why I love her story so much, Deb, is she's us. She's somebody that you and I would go have coffee and brunch with. I think when people think about someone who has substance use disorder, or when people think about someone that has mental health issues, they have somebody in mind. It's one of those people. It's us.
Yeah.
And so when you see this woman, it's one of our friends. And so her story is really compelling. And so, yes, I know we've saved lives because I've heard their stories.
Wow.
Have we saved every life? No, there's going to be people that are going to come to us. We're going to do the best we can, and they're still going to make the decision that they want to make because that's their choice. Mm-hmm. So, you're going to hear those stories too. Well, my loved one went to BH Link and they still killed themselves. I'm so sorry. We did the best that we could. We provided them with the best information we can. Mm-hmm. Again, everyone has their own autonomy to make their own decisions.
Yep.
But I know that we've saved lives because I've heard the stories.
Yep.
And we've changed lives.
And so, this weekend coming up is Mother's Day weekend. And there's a lot of folks, I would, venture to guess, in the last year, we've lost over 500,000 people. So I'm going to venture to guess that there's a lot of people who this is the first Mother's Day without their mom. Mm-hmm. It's, of course, falls on a Sunday. Are you guys open on holidays, weekends?
24/7, 365 days a year.
So if it hits people really hard, they can come in, they can call. Mm-hmm. Doesn't matter what day or time.
Absolutely not.
And obviously it's not just something that can happen on Mother's Day, but I know that these big holidays can be something that really pushes hard on some people's hearts.
Absolutely. These are, this whole last year has been a tough time, but Mother's Day in particular, a lot of people lost their moms in this last year that were not expecting to lose their moms.
Yeah.
That happened very unexpectedly. So yep. I would anticipate this weekend is going to be really hard. And then Father's Day weekend is going to be really hard, harder than what a lot of people would have anticipated. Having lost both my parents and on top being a mom, I know how hard that can be. So I hope people do reach out. And even if someone's watching right now, and even if you think, I don't really think it's bad enough, if you're thinking that, pick up the phone, reach out. Even if you don't reach out to BH Link, call a friend and say, I got to talk to somebody about something. I'm having a really hard time. Someone wants to listen to you. Someone's going to listen to you.
I would rather spend all day, every day on the phone with someone who's in that bad spot than the couple of hours that it takes to go to the funeral.
I mean, all day long. Absolutely. And the more I think we talk about it, the more others are going to start coming out and talking about it. Mm-hmm. And I think that that's really important. I think that people should understand we don't need to measure. People don't need to ever say, well, this is what I always hear. It could always be worse. Oh, absolutely. It could always be worse. But whatever you're going through right now is your worse right now. So don't measure what you're going through by somebody else's yardstick. Whatever you're going through right now is your worst situation. So be in it and accept it and talk to somebody about it.
Absolutely.
That's not weakness. That's being brave.
Yeah, being very brave. Absolutely.
Mm-hmm. Yeah.
So Steph, is BH Link a nonprofit?
We are, yes.
And so how can people support you? What does BH Link need to be successful? So
two things. So one of the things we really need is if you have a connection with any of your elected officials, we need them to understand the importance of them supporting us, through any type of legislation that's going to be coming through to vote on supporting, us anytime moving forward. Our grant ends in 2023. So we don't really know what will happen. We don't know what it's going to look like. We don't know if it's going to be a line item, another block grant. We're not really sure. And I'm not I'm not high up enough on the totem pole to know how all that's going to work. But I would say talk to people in your community about us and understand how important we are. That's one thing. If you're looking to make a donation to us, one thing that we can always use donations for is for food. We like to be able to feed our clients when they come to us. If you're sitting and waiting here, let's put it this way. If you need a bed for mental health, you're waiting a while. They don't exist. You may say, well, we have mental health hospitals. Yep, we do. The beds are always full. And again, that is not to disparage our mental health hospitals that provide amazing, wonderful treatment to clients. But there's a lot of people that need that care. So those beds are always full. So sometimes we have clients that are waiting with us for a while to get those beds. We want to offer them snacks, drinks, things like that. You could go to our website, and there's information there, I believe, on how you could make a donation, or reach out by email if you're so inclined and want to make a donation to us for those types of things.
So even if somebody happens to be shopping over at BJ's and they grab a box of Oreos over at BJ's, they could drop it off at BH Link, and that would be helpful, or a case of water, or gift cards to the local places so that you can order in something from Subway.
I'm sure we wouldn't say no to that. I'm sure we absolutely wouldn't say no to that. Yep.
Yeah, because and I think and I don't want to speak for you, but I think the other really big free thing to do is communicate with your friends and your loved ones and members of the community that it's okay to not be okay.
Yeah. Just talk to people. I think talk to people. If you're here listening to this today, tell a friend, I heard about this place called BH Link. We have a website. If you Google BH Link, it's going to be the first thing that's going to pop up. We have a Facebook page. We have Instagram. We have Twitter. We're all over the place. So talk about it and talk to your friends. Call up a friend and say, are you doing okay? No. Are you doing okay? Have conversations with friends. If there's a friend that you haven't heard from in a while, just pick up the phone, talk to people. Mm-hmm. Don't bury this. Don't bury mental health issues. Don't bury substance abuse issues. Not talking about it isn't going to make it go away. Not talking about it isn't going to make it better. The only thing that's going to make it better is recognizing it and talking about it. And honestly, even if you have friends that are grieving, they want to talk about their loved one that died. Not talking about it isn't going to make them not remember. They're remembering their loved one. They want to talk about it.
Yeah.
So I think the best thing that you can do is just talk to friends. Be honest about your own experiences.
Yeah. And if someone is in crisis, then they can, give BH Link a call at the 401-414 link, also known as 414-5465.
Absolutely.
I know that your information is down there as well, so people can reach out to you directly.
Absolutely. You can call me anytime. If you need to leave a voicemail, I'll get back to you. Mm-hmm. If you've got a question about an older loved one, if you yourself have a question, I'm more than happy to talk to you. If I don't know the answer, I know Deb. and if Deb and I don't know the answer, we're going to find someone that does.
Absolutely. And I can say Steph is one of the few people who actually have my private cell phone number. So
and Deb's one of the few that have mine. So
when there's someone in crisis, we will put our heads together to find that resource that they need.
We've done it before, because I always say, if I don't know it, then you know it. So, and it's true. If I don't know the answer, I'm going to find someone who does. And, unfortunately, Deb, are there cases where we go, how are we going to tackle this one? Yes, but we'll figure it out. We'll find a way. If someone wants the help, we're going to figure out a way to get them the help.
Amen.
Absolutely.
Steph, thank you so much for coming on today. This has been great.
Me.
Yes, I think everybody needs to know about BH Link. The 401-414-5465.
Yes.
Help is available.
It is.
You're not mandated to stay. You can walk into BH Link and you can walk out of BH Link.
Yeah. And some people are going to come in and come out and come in and come out. And then maybe on their sixth time, they're going to go, okay, I'm ready now. And we're going to say, okay, we're never going to say no to you no matter how many times you come.
Yeah. This is awesome. Thank you so much for joining me today, Steph.
Thanks for having me, Deb. Thanks for all you do for the community too.
Thanks. Well, everybody, May is Mental Health Awareness Month, and we just had a great conversation with Stephanie from BH Link. I hope that you've hit the like button and that you've shared this out with your friends, your family, your community groups. Maybe on Facebook, you're in a knitting group. There's probably someone there who will need the information that we discussed today. And we want to make sure that all of our friends and family who might be encountering substance use disorders, drug addiction, alcohol addiction issues, or mental health issues, we want to make sure that they're with us again next year. So if you know someone, let them know that it's okay to not be okay and that help is available. They can call BH Link at the 401-414-5465. We want to keep everybody safe. I hope you all have a wonderful Mother's Day for the moms out there, and I hope you have a wonderful Sunday for everybody who ever had a mom out there. I look forward to seeing you all again next week. Have a great day.
If you liked this video, please follow us on social media and subscribe on YouTube. For more information, visit rielderinfo.com or call 401-585-0509. If you have any questions, email deb@rielderinfo.com.